Americans take precautions.
There's no doubt that wearing masks protects you and gets you to be protected. So it's people protecting each other.
The U.S. Surgeon General begging Americans to take those words to heart.
Please, please, wear a face covering when you go out in public.
As politicians and health officials coast to coast continue to hammer the point home.
Put on the mask. It's not complicated.
California's governor even threatening financial penalties for rule breakers.
We'll be doing more to focus on enforcement in this state.
A new study shedding light on just how effective certain masks can be. Researchers at Florida Atlantic University used a laser to measure how far droplets go with different coverings and found a well-fitting homemade mask stitched with 2 layers of fabric kept particles to just a couple inches away. A bandana was the least effective, allowing those same droplets to travel more than 3 feet away. The scientists say without any mask, particles from coughs and sneezes fly more than 8 feet.
Do you think it's a good idea to ask people to wear their masks?
Yeah, so nobody can catch the corona.
Out on the streets of Miami Beach, where masks are now mandatory, most people we spoke with were on board.
If it saves lives, I definitely am for it.
I don't want to not wear my mask, go around my parents, and then I take the virus around them.
People thinking of others, a positive sign in the midst of a still stormy debate.
It's interesting, Sam, this caught my eye. The investment bank, Goldman Sachs, actually came out with a study on the impact masks could have, not on public health, but on the economy. Tell us about it.
Yeah, the bottom line of this study is pretty amazing, Savannah. They found that the national mask mandate, were there to be one, would be more effective than lockdowns and could save the U.S. about 5% of its GDP. Last year, GDP was $21.4 trillion, which is to say it could save the U.S. more than $1 trillion.
I think it's important to tell you and the American public that I'm very concerned because it could get very bad.
A dire warning from the nation's top infectious disease expert, Dr. Anthony Fauci, testifying Tuesday on Capitol Hill.
We are now having 40,000+ new cases a day. I would not be surprised if we go up to 100,000 a day if this does not turn around. And so I am very concerned.
Vice President Pence now urging Americans to wear masks.
We know how to slow the spread. Wear a mask whenever your state and local authorities say it's appropriate.
Nationwide COVID cases soaring. 28 states seeing an increase in the last 14 days. 45,000 new cases nationwide Tuesday. On Tuesday, Florida had its 4th highest number since the pandemic started, just over 6,000 new cases. The ages of those getting coronavirus dropping too. 19-year-old John Edwards among the many young people who are not afraid.
Are you worried? Yes, I'm worried, but at the same time, it's like it seems unreal, basically.
The tri-state area no longer the epicenter, now telling residents from 16 states to stay away.
None of us want to go back through that hell. We've worked too hard to get here.
Still, New Jersey cautious, delaying indoor dining at restaurants. Massachusetts and New York now requiring visitors from most states to quarantine for 14 days. On the Delaware shore, the 4th of July will be dry. Beach bars now shut down. Since the pandemic began, close to 500 healthcare workers have died. 25-year-old Molly Dawson, an ICU nurse from Kentucky, airlifted to a bigger hospital in Nashville. Doctors tell her mother she may be on a ventilator for up to 6 weeks.
Your daughter's 25 years old. Did you anticipate this?
No, not at all. It's terrifying. I mean, I don't want anybody else to have to experience what we are. And I know it's going to happen.
Jacksonville is now requiring masks indoors, which means President Trump will have to decide when he makes his acceptance speech in August at the convention that's now moved to Jacksonville, whether he'll follow the rules and wear a mask.
After another record-breaking day of new coronavirus cases in California, some 230,000, the state has now hit another grim milestone, the death toll topping 6,000. Nearly half of those who know they are infected live in Los Angeles County, where hospitalizations are at record numbers.
I think we're all kind of looking at the numbers with trepidation, and maybe even a little bit of a sense of dread.
In nearby Riverside County, 99% of ICUs hit capacity over the weekend.
In the ICU, we're doing everything we can, but we're not getting there. We're not saving our patients like we want to.
Facing a new wave of infections, California's governor is ordering beaches, piers, and bars closed before the holiday. Even more restrictions could be ordered today. With many still refusing to wear masks or keep their social distance, similar shutdowns have been ordered in Arizona. Even the start of in-person classes has been pushed back. Dr. Anthony Fauci suggesting pool testing could help reopen campuses. Instead of testing individuals, you could test a group to see if someone in that group has the virus.
If that test is negative, then you know those 10 people are all negative. So instead of utilizing 10 tests, you've utilized one test.
It comes as Texas experiences the highest single-day spike since the pandemic started. At least 17 states are now reversing or pausing planned reopenings. Dr. Brandon Bukowski never left the front lines.
We're not at the worst case scenario yet, but we will be.
This morning, bracing for the next wave as the COVID crisis takes a new toll every day.
The crisis in California and across the West is expected to worsen as testing increases, but it's hospitalization numbers that worry health officials the most. And for now, there is no indication those numbers will get better anytime soon.
Let's turn now to virologist and NBC News medical contributor Dr. Joseph Fair. Dr. Fair, good morning. I'm sure you were watching Dr. Fauci's testimony yesterday saying that if things don't turn around, we could have 100,000 cases by very, very soon. At the same time, you have the CDC deputy director saying the other day, we're past that point. We're past the point of being able to control this. How do you see it?
Well, I don't think the two statements are mutually exclusive from one another. You know, what Dr. Fauci said, if we're following the trajectory that we are currently on and have been observing the past few weeks, we could very easily get to that number or maybe even surpass that number. And as far as what the CDC said in their own statement about not being able to control the virus, this goes back to something you and I spoke about earlier about this virus potentially and increasingly looking like it's becoming endemic to the United States, meaning that it's going to be here until we get a vaccine. All of the traditional measures that we would use to normally control a virus or eradicate it have not worked in the United States in particular for a variety of reasons. Thus, we have the numbers now to kind of make it, I won't say impossible to eradicate it using traditional means, but extremely difficult to do so.
So, I mean, that sounds rather hopeless. What does that mean? You just give up or you just keep trying to do social distancing and the mask? I mean, I don't know where to even go with that. Is it giving up?
Yeah. No, absolutely not giving up. And, you know, I am not ready to throw in the towel. And there are still things that we can do to get through this until we either have better therapeutics or a better vaccine. And, you know, I'll go back to something that we have talked about really since February or March, which is testing. There needs to be a breakthrough in testing to make it very easy, something preferably saliva-based where you don't have to poke someone several times per day. Testing will allow us to know where we need to focus our energies the most. It will allow us to do that isolation and contact tracing that Dr. Fauci said we need to do so aggressively. We need to recruit a contact tracing corps and, you know, think about census takers. It would be the same kind of thing. You don't need to be a doctor to do contact tracing. So if we did all of those things starting now, and I emphasize the earlier we start, the quicker this will be over. If we did all of those things now, we still have an opportunity to control the virus and reduce it greatly.
And what about masks? Because we saw yesterday a lot of top Republicans, Mitch McConnell, Kevin McCarthy, Lamar Alexander coming out and basically saying, come on, everybody, just wear a mask. Will it make a difference? Could it really stem the tide?
You know, I think what confuses people the most about the mask has been the conflicting guidance. And I myself even gave some of that guidance in the beginning because I was following what we knew from SARS. And that's what those guidance, the original guidance was based on. Overwhelmingly, since this outbreak has started, we have seen that masks both aid in the prevention of the disease and to a much more limited extent catching the disease yourself. So masks seem to be the key public health intervention that we can use in addition to social distancing, of course, but masks seem to be the key intervention that we can use to prevent the spread of the virus further.
All right, Dr. Fair, good to get your perspective as always. Thank you so much.
This morning, President Trump is facing growing pressure from Capitol Hill to respond to mounting reports suggesting Russia offered cash bounties to the Taliban for killing U.S. troops in Afghanistan, with administration officials set to brief congressional leaders of both parties today. House Democrats expressed frustration with the White House briefing they received Tuesday.
The right people to give the briefing really were not in the room. We need to hear from the heads of the intelligence agencies about how they assess the allegations that have been made publicly.
The president has insisted he was not initially told about the intelligence, but NBC News has confirmed White House officials became aware of the reports as early as 2019. The White House press secretary insisted the president has now been briefed on the matter, but wasn't initially because she said there was no consensus over the intelligence. And when pressed whether he reads his presidential daily brief, responded.
The president does read, and he also consumes intelligence verbally. This president, I'll tell you, is the most informed person on planet Earth when it comes to the threats that we face.
Former Vice President Joe Biden lacing into the president.
If he was briefed and nothing was done about this, that's a dereliction of duty.
And among those asking for answers this morning, Eric Hendricks, the father of Corporal Robert Hendricks, who was among 3 Marines killed in a car bomb in Afghanistan last April. That incident now under scrutiny by U.S. intelligence officials as potentially part of the Russian bounty payments, according to multiple reports, but not confirmed by NBC News. Hendricks told NBC News in a telephone interview, quote, "It would break my heart if the reports were true," and added no one from the Trump administration has reached out to his family since the Russia revelations, and he has yet to hear from President Trump since his son died. Why hasn't anyone called me? Hendricks asked. An anti-Trump conservative group, the Lincoln Project, is targeting the president in this new ad, with an ex-Navy SEAL calling him unfit for office.
Mr. Trump, you're either a coward who can't stand up to an ex-KGB goon, or you're complicit. Which is it?
Now, as for Eric Hendricks, the father of the late Corporal Robert Hendricks, he says he does not vote but leans toward supporting President Trump and is hopeful there can be answers soon. Meanwhile, many Republican lawmakers are rallying around the president, stressing that the intelligence was not verified. Still, experts in the matter say it's not unusual for officials to disagree on intelligence assessments. And Craig, as we have been on the air, the president tweeting just moments ago, calling this whole thing, quote, just another hoax.
There's some other headlines from Joe Biden's briefing on Tuesday, the former vice president's first briefing in months. He was asked if he'd been tested for cognitive decline. What happened there?
That's right, Craig. It was notable when Joe Biden was asked by a reporter about whether he has been tested, as you say, for cognitive decline. Here's that headline-making exchange. Take a look.
Have you been tested for some degree of cognitive decline?
I've been tested and I'm constantly tested. Look, all I got to do is watch me, and I can hardly wait to compare my cognitive capability to the cognitive capability of the man I'm running against.
So there you have it. Now, Biden, who is 77, has come under scrutiny for at times stumbling or forgetting facts on the campaign trail. President Trump is 74 years old and has also been asked about his physical and cognitive health. The White House doctor recently weighed in on that, saying the president remains healthy.
This morning, Harvey Weinstein's accusers are one step closer to another legal victory. 9 women who sued the convicted rapist reaching a settlement Tuesday that, if approved, would create a victims fund worth nearly $19 million.
This settlement is for any woman who was abused by Harvey Weinstein. She need not have come forward before. She need not have told her story in the press or have filed a lawsuit.
The deal, 2.5 years in the making, releases women from any non-disclosure agreements. Weinstein will not admit any wrongdoing, and he won't pay accusers. Instead, insurance companies for his former studio, which filed for bankruptcy, will make the payouts. Caitlin Delaney, who says Weinstein sexually assaulted her in 1996, is one of the plaintiffs in the case.
It's a very, very positive thing to come out of an incredibly complicated situation. And it has the potential to really make a difference for a lot of women that were harmed by Harvey Weinstein.
The settlement also resolves nearly all of the civil cases against Weinstein, including one brought by New York's Attorney General, who celebrated the deal, writing in part, "After all the harassment, threats, and discrimination, these survivors are finally receiving some justice." But lawyers for 6 other Weinstein accusers are blasting the settlement, calling it a complete sellout of the Weinstein survivors, adding that it fails on so many different levels, and calling it deeply unfair that Weinstein accepts no responsibility for his actions. But those who support the settlement say it's the best option.
There will never be enough money to compensate survivors of Harvey Weinstein's abuse. But what we do know today is that we secured justice for these women.
Weinstein, who has repeatedly denied allegations of non-consensual sex, is now serving a 23-year sentence, convicted in New York in February on charges connected to 2 women. He still faces separate sex crimes charges in Los Angeles. An attorney for Weinstein telling NBC News, with closure in sight on one front, Mr. Weinstein remains intently focused in defending himself on all remaining legal matters.
So, Kate, with regards to timing here, how long until this victims fund is up and running?
Right. So it's a little unclear. A district court and a bankruptcy court still need to sign off on this deal before anything can happen. A preliminary hearing to approve it is July 14th. If it gets the green light, Craig, then the attorney that we spoke with thinks that women will have about 90 days to confidentially submit claims describing their experiences with Weinstein, which will then be reviewed. Potential payments could range from $7,500 to $750,000 and could come after what that lawyer hopes will be final approval, which could happen in mid-October.
And half rejecting science.
I won't be doing it personally. It's a recommendation, okay?
In city council meetings.
You literally cannot mandate somebody to wear a mask.
In stores.
I have a breathing problem. My doctor would not let me wear a mask.
And even in the halls of Congress.
Unfortunately, this simple life-saving practice has become part of the political debate.
I am very concerned.
Speaking to senators Tuesday, Dr. Anthony Fauci making the startling prediction the U.S. could soon have 100,000 new COVID cases a day unless Americans take precautions.
There's no doubt that wearing masks protects you and gets you to be protected. So it's people protecting each other.
The U.S. Surgeon General begging Americans to take those words to heart.
Please, wear a face covering when you go out in public.
As politicians and health officials coast to coast continue to hammer the point home.
Put on the mask. It's not complicated.
California